Hello class and professor. Today me and my team will discuss two imaging technologies currently being used in nuclear medicine and X-ray clinics to produce co-register images, or images that combine modalities to produce an image with two separate dimensions. We'll also discuss, is the cost of the dual PET MRI machine worth the cost that comes with the price tag? Starting with a little bit about PET. PET is also known as positron emitting tomography. It's a nuclear medicine imaging technique of shaping metabolism and function of the human body in an image. Now, this obviously cannot produce an image that tells anything about the anatomical information nor the anatomical structure, merely the biochemical functions surrounding the particular image. This is where hybrid imaging technology comes in. Combined by the minds of David W. Townsend and Ronald Nutt, this new technology will combine two images to produce a single image that will show both the anatomical structure as well as the biochemical structure. Starting with PET-CT, also known as positron emission tomography, computer tomography. The concept here is rather simple. It combines a PET scanner with an X-ray CT scanner, so images acquired from both devices can be uploaded simultaneously and laid on top of each other with no mistakes. This will create a fusion image. This will allow the functional imaging of PET, which depicts the chemical activity in the body, with CT scanning, which is the anatomical structure of the human body. The combined result will add precision to the overall diagnosis and reveal previously unknown problems as new links are being shown between the anatomical structure and the biochemical structure. Since its worldwide adoption, PET-CT has revolutionized the fields of surgical planning, radiation therapy, oncology, and nuclear medicine by combining two essential devices into one and producing a fusion image that is perfectly centered and aligned. Moving on to PET MRI, or PET magnetic resonance imaging. This is a brand new hybrid imaging technology currently being used only by the most sophisticated clinics worldwide. It is very similar in nature to the PET-CT, except it creates a morphological image instead of an anatomical image. This means that it will be a lot more in-depth and will target soft tissue instead of just the overall anatomical structure. This time it will create a functional image along with a morphological image that will combine to allow an in-depth look into both the soft tissues and the metabolic and biochemical activities surrounding that particular soft tissue, revealing a lot more about the actual activity in that particular area than the PET-CT. Now, since its introduction in 2004, PET MRI has been used at least 80 times worldwide. We're currently on the slope of disillusionment, which means that it will go slightly down as people are awaiting the epidemiology and the data surrounding that particular technology. However, it is expected to rise shortly afterwards when its cons are being slightly reduced and its pros are being recognized. PET MRI has been slowly becoming the main method of obtaining soft tissue images. The use provides unparalleled soft tissue detection and presentation that far exceeds the ability of CT scanning. However, this new technology does offer a few cons, such as the high cost. Now, see in the final graph, PET MRI costs approximately $5 million to $7 million, while PET-CT only costs 1.5 to 2.5. This huge cost gap could mean that countries that is being disadvantaged in terms of financial institution will be unable to afford such technologies. However, MRI will produce an image that is far superior in quality to CT, will put out not only the anatomical image but also the metamorphological imaging. It also provides significantly less radiation, however, it will use a little bit more time for the image to come out. Of course, we've listed all the advantages here for you to have a look at. It provides significantly less radiation dose. It provides far better soft tissue contrast. It allows simultaneous acquisition, which means that two layers of image are perfectly aligned. It will also allow for additional techniques to be used on top of MRI in order to create a more succinct image with a lot more data, whereas PET-CT will be stuck in the past. My partner Han will now explain the more advantages of PET MRI in a clinical setting.
So in a clinical setting, PET MRI has contributed in different areas. In oncology, so here is the example. It can produce more accurate diagnostic. So A and D are the PET-CT image. B, C, and E, F are the PET MRI image. So both examinations were performed for cancer staging. The transsexual CT image with PET fusion revealed multiple small lymph nodes, increased in number but not in size. The lymph nodes were too small to resolve on the PET image. In contrast, diffusion-weighted MRI gives a result that is in a more definite diagnosis of node metastatic disease. So there's another example. PET MRI can produce better spatial registration of PET image. PET MRI has better classifications than PET CT finding due to better spatial resolution of PET images. Both PET MRI and PET CT indicate hotspots in the liver, but the PET CT image, which are A and C, cannot distinguish whether it is a metastatic disease or an infectious process. Other subsequent PET MRI, which are B and D, it gives more information about the soft tissue. The findings suggested that the PET images from the PET CT examination had been misregistered to the CT images. This focus of the increased uptake in PET image within increasing lymph node should be a node metastatic disease. So in an integrated scanner, the MRI data acquired simultaneously with the PET CT, and it can provide more accurate information in neurologic disease. The PET data can be used to obtain high temporal resolution rigid body motion estimates, more often in the background of the actual MRI data acquisition. Together, this method could increase the reliability and the reproducibility of the PET data, and this could potentially benefit a number of neurologic applications that require precise qualification or that involve uncorporate subjects such as Alzheimer's disease, movement disorder, or pediatric patients. PET MR has been used very often in research of neurology. PET MR has been adopted widely in different research centers. Neurologic disease is the current leader in disease burden rank according to World Health Organization. So development of PET MRI can relieve the disease burden. In cardiology, PET MRI can also provide lots of benefit. Especially, it can provide the motion image of the heart, which provides better diagnostic detail in cardiology.
Now, of course, as with all new expensive technologies that are up and coming, there are always concerns in the integration of this new technology into an already established workplace. In this particular case, the MRI's magnetic fields tend to interfere with the PET, causing various malfunctions within the actual detecting crystals. This will produce inaccurate results that will ruin the overall diagnosis. Here on the graph, you can see 3 particular images that will depict 3 separate ways for us to engineer the PT-MRI machine to create one that is more suitable for a clinical setting. The first one, or A, is sequential, where PET/MRI are placed in sequence to each other. This will require a heavy amount of shielding and do not support simultaneous acquisition, meaning the overall image will be scattered and not linked properly. The second one, B, is called insert. It involves building a special ring to hold the PET, which will resist the magnetic waves and prevent interference. This is one of the most effective ways to construct the PET-MR, but it will limit the amount of space with excessive constructs. This could cause overheating and cause to be quite cramped. The third one, or C, is known as integrated. This involves a brand new technology that will incorporate all the elements into one packaged machine that can be used at a low level of magnetic resonance. This once again suffers from a limited space, but is currently the best option for a new machine. Now, the cost of PET and MRI might be significant and can prove very hard to access people in a disadvantaged position, but it is an invaluable tool to save the lives of millions. In terms of ethics, the famous line by New York-based Zuen Passeri says, "You can't justify the cost, at least in my mind's eye. If you're looking at an ROI, you're not going to find it. The way I can justify the cost of spending money is that it will save lives, and in this case, it does save lives. Since the deployment of PET-MR, the rate of death by cancer has gone down to 14% in Australia, 2014-2015. In this sense, the PET-MR is heavily justified, as you cannot put a price tag on saving lives." In conclusion, the overall PET-MRI is a modality with amazing potential and defeats the PET in every way imaginable. With proper engineering and successful integration into a clinical setting, it could prove invaluable in the cardiac and nuclear industry. And thus, the cost of dual PET-MRI system is definitely worth it. Thank you.